glad to be here, and I'm hoping that today everyone's going to be have the ability to take home something new that you didn't know before that you can take home to your family or even take home to yourself to ensure that you're going to remain safe during this cold and flu season. Before I start, I'm just going to let everybody know that I'm going to be going through the slides, but at the same time, I'm the kind of person, yeah, I don't mind talking, but I try not to read verbatim off the slides all the time in a way to try to prevent anyone from getting bored, because sometimes some of these slides have a lot of words, and it's like, you know what, there's no point on reading this verbatim. It's just to hit the point and get off to the next slide. But we're going to try to make this as I would say interactive as I can, being that we're doing this virtual. And again, as I stated, I'm hoping that by the end of the day, you're going to take home something that you didn't know before, that would help protect you, keep you safe, and you're also your family, your loved ones safe as well at the end of the day. So without further ado, let's get to this. So again, our topics today are going to be on influenza. I'm going to talk a little bit about influenza A, influenza B. I'm not going to get into it too much. Again, as I stated, I'm just going to touch upon the little slides, just a little touch on the slides. We're going to talk about RSV and COVID-19 and how we're going to keep ourselves safe in terms of signs and symptoms. And towards the end, I'm just going to talk about the vaccine. I'm not going to get into it too much, just to understand that there are vaccines out for this as well. Then I'm going to be hitting on the breaking the chains of infection. A lot of this presentation is going to be wrapped around that theme of breaking the chain of infection, because as we talk about cold and flu season, it's always about influenza, RSV, or COVID-19. Primarily, it was COVID-19 for the last 4 or 5 years, but now we got influenza and RSV that's mixed in there. So we're going to talk about ways and means of breaking that chain. And when we break that chain, we're going to talk about how you're going to keep yourself safe and how you're going to keep your loved ones safe as well. And then, as part of that whole breaking the chain of infection theme, we're going to roll into hand hygiene, keeping ourselves and our clients safe, what it is and how we have to wash our hands in order to keep ourselves safe. Because hand wash or hand hygiene is the single most effective way of preventing the spread of infectious diseases. Remember that, because that might be a question later on. And then we're going to talk a little bit about additional precautions. I'm not going to get into much because we only have an hour today. So we're just going to talk about gloves, gowns, masks, and face shields, when we wear it. I'm not going to talk about how to put them on, how to take them off. But we're going to talk about, there's certain times and periods that we should wear it to protect ourselves. And when I talk about protecting ourselves, we're also protecting those loved ones who are around us as well. Because if we come into work and we're sick and we're around other people that are sick and they're transmitting and we get sick and it's just one big line of transmission, and then we have an outbreak. So we're going to talk about that really briefly as well. Then we're going to talk a bit about cleaning and disinfection. I always say in a lot of my outbreak meetings, I used to, well, I still do it on some weekends. I'm a IPAC specialist for a company where they go around to all the big medical buildings in Toronto and they do disinfection and cleaning. Having worked in infection control for 25 years, I always say that's one of the most important parts of infection control, is ensuring that the area that you're in is clean and disinfected properly. So we're going to talk about that briefly as well. Then we're going to get into vaccines. I'm not going to bore you. I know everyone knows that there are vaccines out there, but we're going to talk just point by point on the universal influenza immunization program, which is out there, where we all hopefully we should have been vaccinated already for influenza, COVID, or RSV. And then some closing remarks and Q&A. If you have any questions for me, if you want me to shut up, just tell me you're done and we're out of here. If you want to have any questions, by all means, ask away at that time. Or if you don't want to speak because you're a little nervous or shy, I am sometimes too as well. By all means, you can send me an email and we can chat offline as well. So let's begin. RSV, COVID-19, what we really need to know. Again, as I said, we're just going to be touching on these subjects very briefly. I just want everyone to learn the basics about this and why it is that we do what we do and how to keep ourselves safe during these periods, especially now when we're going through cold and flu season. So again, influenza, as we know it, is a cold or flu virus that spreads easily and can affect people via their nose. It's caused by something called influenza A and B virus. So what happens every year is, what we do in public health is, as much as it's summertime here, it's wintertime somewhere else. Many years ago, my sister went to graduate school in South Africa in Cape Town, and I used to go visit her every summertime. And down there in our summertime, it's winter, kind of like in Australia as well. When it's summertime here, it's winter there. So what tends to happen is the government or World Health Organization, CDC, Health Canada, we follow this virus as it moves around, based on the temperature and based on the region and we kind of have an understanding of what we're going to be dealing with. So every year we come up with this new vaccine that's tailored to what has been shown to be prominent in the environment. So with influenza A and B, that's what we do, and that's how we know what type of vaccine to give those when it comes to influenza A and B season or cold and flu season. So in influenza, what happens? It's spread by droplets. So what happens is if I'm infected with influenza and I'm talking to you and I'm spraying as we typically do when we speak, I'm a spitter when I speak and I'm infected, we spray these small droplets into other people's faces that they don't know. It's called aerosolization. And that's how those other people or other people become infected or get sick with an influenza vaccine. Sorry, influenza virus. As well as with influenza, because we're spraying and there's a lot of aerosolization, what happens is if I'm infected, it can also fall onto inanimate surfaces or surfaces of things. We call them fomites, if you want to know what inanimate surfaces. You walk along, touch it, you rub your T-zone, which is your eyes, your nose, your mouth. You inherently can become infected through that way as well. But typically, again, as I said, around this period of time, excuse me, I'm not feeling the best today. We do deal with these viruses based on it being winter. We're inside, we're indoors, we're close to one another. So it makes it just perfect environment for these things to spread. And what we're looking for in terms of symptoms for things like influenza is we're going to be looking at a fever, cough, muscle aches and pain, headaches, chills. Primarily with influenza, the big one is the muscle aches and pain. Typically, when you have influenza, you have severe muscle aches and severe muscle pain, and that's usually a key indicator of the person being infected with influenza, as well as the fever as well. And then with little kids, we're talking about nausea and vomiting. Now, how do we know you have influenza besides just knowing that you're sick, kind of like me right now, how I'm feeling sick? We test you. So we take something called a nasal pharyngeal swab. It's a big little wire. I know that we just went through COVID, so everybody knows about MP testing and swabs. We roll it around in your nose, sometimes in your mouth, and we send it off to the lab and we get a confirmation that way. And that's how we know you have it. And the reason why we make this such a big issue around this period of time, while we're like, okay, we got to find ways and means of keeping you safe and your family safe in around cold and flu season. You don't hear about it all the time unless you've been affected by it personally. Like for instance, I have. About 12,000 people are health or 12,200 people are hospitalized because of influenza every year, but we get about 3,500 deaths every year. And in my case, I've had a family member and a friend of mine whose father passed away many years ago from complications to influenza. And that's just one of the reasons why we put so much emphasis now on caregivers and understanding what these things are and how to protect yourself, because we're taking care of those who are considered as high risk clients or high risk loved ones. There are people who are hospitalized who have other health issues, be it chronic health issues like diabetes or heart and lung disease, which I have. People who live in long-term care homes and other chronic care facilities, they tend to be at high risk, and those who are 65 years of age and older. So if you're in one of those high risk groups in and around this period of time, it's very important that you take care of yourself nutritionally, ensuring that you're eating well, ensuring that you are vaccinated or immunized for the virus for that strain of that season, and ensuring that you're staying away from those that are ill and possibly in some cases even wearing masks if that is the case. So hence the reason why we're pushing keeping ourselves safe. Now, if you do get it, there is treatment. We got antivirals. We call it Tamiflu. Those of you who are really into the medical name Ostelomivir, which is an antiviral drug which is prescribed, and this can inherently reduce your period of time that you're sick. So a couple years ago, I had influenza, and I was really bad. Got antivirals, and I recovered fairly quicker than normally. So we have treatment such as antivirals. And again, as I said, for prevention, we have the vaccine. And that's why every year we're saying to everybody, get vaccinated. We have influenza vaccine, we got the RSV vaccine, we got the COVID vaccine. I know it sounds like a lot, but at the end of the day, it's there to help to protect you. There's nothing nefarious about it. It's there to prevent any severe complications if you are infected with influenza at the end of the day. RSV. As I told you, we're going to talk about the three big ones that we're dealing with right now. It's a respiratory virus as well, just like influenza. It affects the nose, throats, and lungs. And the symptoms are primarily sound exactly like the same thing like influenza, where you have a cough, runny nose, sneezing, wheezing. You may get a fever with this as well. But typically with RSV, it usually happens within 2 to 8 days after getting infected. So you have to understand that with a lot of these viruses, um, you don't just get infected right away. If you want to get into science and stuff, it's called incubation period. You get infected today, it'll take you 2 to 3, sometimes 4 or 5, and in this case, even 8 days before you start presenting with symptoms. And typically, when the symptoms start, that's when you're really highly infectious. Again, with RSV, MP swab is what we use to verify whether or not you're positive for it. And just like influenza, how is it spread through respiratory droplets? So again, as I said, I speak. Just now I was talking and I felt a little drop on my hand. Um, what happens is as we speak, we naturally aerosolize. So if you are infected, just like influenza, and you're speaking to somebody, you don't have a mask and you're sick, and you're in that period of sorry, I'm gonna get to the science period of communicability. There's always that slight likelihood that you will get that person sick as well. And people who usually have it are usually contagious for about 3 to 8 days and become after a little bit, after the fever has stopped, after symptoms start declining, they're no longer infectious at all. So just a little reminder about these things and how can help stop the spread. Again, you're here for that. We cover our sneezes, we cover our coughs with tissue or in our sleeves or in our elbows. We call that respiratory etiquette. We clean our hands. We're going to get into that a little bit later on, often with soap and water, or alcohol-based hand rubs, which we're going to get into a little bit later on too as well. One of the biggest ways, most important ways, again, as I said just now, the most effective way to prevent the spread of infectious diseases is through hand hygiene, washing your hands. And again, remember that because that might come up later on in this presentation. And then another one, we want to clean frequently touch surfaces, doorknobs, mobile devices, um, areas that we touch a lot. If you're in a place where there's the elevator buttons, you want to clean and disinfect those as frequently as possible. And also wearing a well-fitted, highly quality mask. Now, the verdict is out. Over the last little while, there has been some publications by Public Health Ontario. I'm not too sure if anyone's read that there is little to no massive differences between wearing N95 or a medical mask. So either or works. Well fitted, not fitted that well, but some form of medical mask will help to minimize that risk as well. And again, as I said, getting that RSV vaccine or ensuring that you're taking care of yourself nutritionally as well. Avoid smoking and cannabis products. And again, with RSV, there is a vaccine, Abriozovo. Sorry, I apologize for butchering that name. And Biofortis are the ones that are being used. And anyone who's 60 years of age or older and now eligible for a publicly funded vaccine can speak to their health provider about receiving it, regardless through private purchase or at your pharmacy. So there are vaccines out there to protect you against these things. And again, I highly recommend it if you're high risk yourself, if you're dealing with people who are high risk, it's a good idea to look at getting vaccinated for these viruses. And then the worst we'll leave for the last. Reason I put this last is because we've all been COVID-19 out, including myself, since 2019, 2020. This is all I've been talking about and hearing about for the last few years. So I figured you didn't want to hear about this too much, but COVID is still out there. We do have a lot of COVID, RSV, and influenza that's circulating in the community. Hence the reason why our hospitals are getting inundated with a lot of ill people. It still is out there. So just a quick blurb on COVID, which I'm sure everyone knows this better than I do now because we've been dealing with this for the last 4 or 5 years. It's a virus that results in a range of illnesses from severe symptoms to mild symptoms and spreads mainly from person to person through, again, just like everything else, respiratory droplets. So if you're close contact with somebody, just like an influenza or RSV, and you're speaking and you're aerosolizing, you're going to get that person possibly sick as well if they've not haven't been vaccinated. And you have to understand the whole point of the whole vaccine thing isn't really to say you're not going to get it. It's to reduce the chances of complications, reduce the risk of hospitalization, and reduce the chances of death as well. So those are some of the reasons why we get those vaccines. And the people who we're looking out for, again, we're here for this today, is to ensure that those who are 65 years and older or vaccinated are taken care of, and these certain precautions are being met to ensure that they're safe as well when they're at home or within your care. And again, symptoms, I'm sure many of us have had COVID. We know it's fever, cough, shortness of breath, fatigue, muscle aches or body aches. And one of the things that make this very difficult, I always tell people, I've been doing this for 25 years. I've seen every. I remember dealing with SARS-1 when it was in Toronto in the hospitals. A lot of these symptoms all sound the same. So a lot of times we'll sit there, okay, this person has X, Y, and Z. It sounds like this, it sounds like that, but they all sound the same. The only way that we can differentiate whether or not you're positive or not is, again, testing. So nasopharyngeal swab, or in some cases, even blood work will even tell us whether or not a person's positive or negative. So I want to get you guys a little interactive just to have you. I know it's very quick because we just went through a few slides. I just want to see if anybody was listening to me at all. But first question I have for everybody today, and please, by all means, participate, is is the government program? I'm positive. I'm sorry, but can you move that to the side a little bit? It's just kind of popped up in the middle. But does the government provide vaccine, funded vaccine for RSV, influenza for all high risk individuals? Yes or no? And you know what? You guys so far pretty good. And I think we'll give it a few more seconds. And you are correct. I have 100% here. So yes, you guys are listening to what I'm saying. I haven't bored you as yet, so that's a good sign. So yes, government is funding a vaccine for these people or for those who are considered high risk. So again, I remember high risk are those who are living in long-term care or any chronic care facilities, hospitalized. Those are 65 years of age or racially qualified, indigenous, children as well. Those are the ones that are being funded as well for any of these vaccines because they are considered high risk criteria. And those who, like yourselves and myself, who work in community support services where we provide care. So as a caregiver, you're dealing with someone who is high risk. So it's very high, I think very it's highly recommended that you be vaccinated as well. And they do provide this free of charge. Thank you so much, guys. Next slide. So this is going to be the center of our discussion today, which is, and I should just say it's not going to be on just influenza alone. It's going to be on something that we call the chain of infection. And what that does is we have a chain of infection that we deal with when we deal with any type of virus. So it's going to be the agent, the reservoir where it lives, the way it, or the route that it gets out, so portal of exit, the mode of transmission, how is it I'm going to infect you, the portal of entry, how I'm going to get infected, the susceptible host, myself or that person who's infected, and it rolls right back down to the agent. So a lot of times, I'm just going to give you a brief infection prevention and control lesson here. Is whenever we're dealing with any infectious disease, this is what we use to determine how we're going to prevent this from occurring. So as an example, we have influenza A as the agent. We'll have the person affected with influenza as the reservoir. We'll have the more portal of exit, how it gets out of the body, which is the mouth, the nose of that person or who is infected. The mode of transmission, which we'll get into, not very difficult, but I'll break this down to everybody very shortly, which is contact and droplet precautions. We have the mode of entry, which is either your eyes, your nose, your mouth, or another person. The susceptible host, which is anybody, could be myself, you who haven't been vaccinated as yet for COVID or for influenza, and then it rolls right back up to the agent. And the way that we fight or prevent the spread or keep you safe and keep ourselves safe is by breaking this chain. I apologize. So again, the theme today is going to be how are we going to break this chain in order to keep you safe, keep your loved ones safe, and keep the people around you safe, which are, again, as I said, is your loved ones. So we're going to give a few examples. I'm going to go through these systematically and show you what you can do to keep yourself safe, to keep your loved ones safe, and to keep those around you safe. And by doing that, we're going to talk about respiratory etiquette and masking. We're going to talk a little bit about physical distancing, PPEs, hand hygiene, and cleaning and disinfection. We're going to talk again about PPEs and hand hygiene because this can be repetitive in all the other cycles. And then we're going to talk a little bit about immunization and vaccination as well. So, again, understanding this concept is what's going to be keeping you safe and going to be keeping your loved ones safe as well as a caregiver. So, I'm going to put first emphasis on agent to reservoir. So with agent to reservoir, what tends to happen is we're dealing with the agent and then we're dealing with the reservoir, the person who's infected. And the best way of breaking this chain, again, I don't want you to memorize this per se. I just want you to understand the concepts in between. So the best way of breaking this chain of infection is by cleaning, disinfecting, and even providing infection prevention and control policies, which you don't really have to deal with. It's not on your spectrum, but cleaning and disinfecting is. So what do we mean by cleaning and disinfecting is, first of all, when we talk about cleaning something, we're talking about physically removing of organic material such as blood or secretions. Physically removing rather than kills, sorry, physically removing something doesn't kill the organism or virus. It's just by the mechanical motion of you cleaning it with a product will help to remove the bacterial load. So this is really important. The other important aspect of this in keeping yourselves healthy or keeping yourselves and the loved ones around you healthy is also disinfection. And when I talk about disinfection, we're talking about inactivating the disease or inactivating the germ. So what we're doing is we're killing the virus now. We're killing its spores. We're putting a solution, a chemical solution that's now going to kill that organism. So guess what? If I were sick and I'm spewing whatever it is I have, COVID, RSV on a table, and you come along, you're like, hey, Dill, you don't look too good. I'm gonna wear my mask, gonna wipe down this area, keep it clean. Guess what? You've now broken that chain of infection because if someone else who comes around here who isn't sick, who may touch that surface and rub their face or nose, they're not gonna pick up anything because it's been clean and disinfected. So again, this is a very important concept in breaking that chain and in keeping yourselves safe because if that is not on if the area that you're working in and the area that you're providing care as a caregiver is clean and disinfected, those chances of you being infected or infecting other people has been minimized dramatically as well. And just a little bit about the cleaning products that you'll use if you are dealing with this, as well as ensuring that whatever you're using has a DIN number on it, is within the expiry date. It's typically a one-step cleaner and disinfectant. So the one step is so much easier. Same cloth, same sheet that you're using that you pull out of that disinfectant is what you can use to clean and you can use to disinfect, which makes things so simple and so easy. And then you also want to ensure that there's short contact times, about 5 minutes or less. So you want to ensure that whatever product you're using, mind you, you can use 10 minutes or above because we're not in healthcare per se. But if you're working in a healthcare organization, then it has to be 5 minutes or less in terms of contact time. So when I say contact time, I'm talking about when you're cleaning something, that area needs to remain wet for a certain period of time for it to be clean and disinfected properly. And usually that contact time of 5 minutes delineates whether or not that surface has been disinfected properly and has given enough time for the virus, the bacteria, or whatever it is that you're trying to remove has been killed as well. And again, we don't like using squirt bottles. We like to wipe. Wiping is always the preferred method. And that if you spray, you're aerosolizing whatever is out there. And again, I'm not going to get into this particularly too in depth, but understanding that there are products out there that are really good to use. There's Lysol wipes that can be used. There's Lysol chemicals or benzyl ammonium chloride that which can be used, which has a contact time of 6 minutes. A lot of this stuff that you see here, you can buy straight off your shelf, and it works really well wherever you're working, whichever home you're working in, whichever long-term care home you're working in, wherever you're providing that care and that support. This can be used to clean and disinfect the area properly, and it will kill all the organisms. It will kill viruses. It will kill germs. It will kill any pathogen. It will kill as well. And just again, another example, COVID times. I'm sure everyone's seen these Cavi wipes, really good disinfectants. And when I talked about those one-step cleaners, this is what I was alluding to. Nice and easy, cleaner and disinfectant all at the same time, and it works really well at killing any organism or any pathogen that's out there as well. And again, I just want to give you guys just a brief look at what we need to do to keep ourselves safe and to keep the loved ones around us safe. Because if everywhere is clean and disinfected properly, the chances of you getting sick or having your loved ones sick as well, it's really dramatically declined. And I haven't done this for 25 years. Whenever I walk into an outbreak or managing an outbreak, be it in the community, COVID, or being in a long-term care home or a hospital, a lot of times I can associate whether or not the outbreak's going to last long or whether it's not it's going to be a short outbreak based on the ability of the cleaning staff cleaning the areas properly as well. So these make a massive difference. And again, just a quick synopsis of what we're talking about in cleaning. We're talking about ensuring our hands are clean before we start. If we got to wear PPEs, we got to put those on before we start as well, assessing whether or not the area really does need to get clean, and ensuring that we're cleaning the area properly. So from clean to dirty, high areas to low areas, top to bottom, and ensuring that we're doing the washrooms last as well. Those are some of the things that we have to consider if that is part of your responsibilities as well. And again, also ensuring that the area is clean and that anything that needs to be disposed of is disposed of. So replacing garbage bags, removing non-hazardous garbage bags, and separating dirty cloth from clean cloths as well. And then again, once everything's done, if you are cleaning, ensuring that you yourself, again, we're as much as we're trying to keep those around us safe, we got to keep ourselves safe because if we're not safe, we're going to keep them unsafe as well. So once you finish cleaning up, you got to make sure, again, as we talked about, which we'll talk a little bit more a little later on, is on hand hygiene as well, ensuring that your hands are cleaned right after you've stopped cleaning and you've taken off your PPEs. Now, let's get into reservoir, portal of exit, and mode of transmission. Again, as I said, the whole premise and theme today is breaking this chain of infection because if you break this chain of infection, as I stated, and I'll say it again later on as we move further on in this presentation, if we can break this chain of infection, we're actually minimizing and diminishing the propensity of the spread of infectious diseases. And again, as I stated, we're dealing with COVID, we're dealing with RSV, we're dealing with influenza around now. Those things are fairly easy to kill. So if we do this properly, we'll keep ourselves safe and we'll keep those around us safe as well. So let's talk about reservoir, portal of exit, portal of transmission, or mode of transmission, and how it is related to caregiving and keeping ourselves and keeping the loved ones around us safe during these times. So breaking this chain, we have the reservoir. And to break that chain is typically respiratory etiquette and masking, which in terms relates to portal of exit and transmission, which again, hand hygiene, PPEs, cleaning, and food safety isolation also helps to break that chain. So it might not make sense to you right now, or some of you might already picked up on what I'm trying to say here, but I'll get into it a little bit more as we move into the other slides as well. But just keep those in mind that we're talking about respiratory etiquette, masking, hand hygiene, PPEs, cleaning and disinfection, food safety and isolation in order to break this chain of infection. And what I like about this, which is really interesting, I always relate it to that Swiss cheese effect. As a pilot, we talk about the Swiss cheese whenever there's an accident, it's just everything gotten through the Swiss cheese. Meaning we put up every barricade and everything has made it through that Swiss cheese and has caused an accident. And what I like about this is we're breaking the chain. So once we break that chain, that propensity, that chance of the accident occurring or that person being infected has been greatly reduced, and in some cases is next to nothing or next to nil. So let's just get into it here. So again, dealing with this whole breaking a chain of infection, if someone's sick, putting a mask on that client or on that patient or that resident or that loved one makes a massive difference. So anyone who has a new acute respiratory illness, who's coughing, has a fever, and you're providing care to this person where maybe you might have to take them out somewhere. It's not a bad idea to put a mask on them as well. This helps to reduce that risk to yourself. And again, as I said, if you're feeling well and you're not sick, you're making those around you safer as well. So remember that as well. It doesn't matter. I know it says here clients, patients, residents should not never wear an N95 respirator. And again, as I said, the verdict is out. Doesn't really matter. Well fitted, medical mask, surgical mask, anything goes right now in terms of relating to minimizing that risk. Putting on that mask is a big one, and putting it on correctly. Um, During COVID, when I first started, I remember I used to see, and including myself, because I'm not used to wearing masks frequently, putting on the mask incorrectly. We have to understand that putting the mask on correctly helps to minimize that risk. So again, as I said earlier, in washing your hands before you're doing it, ensuring that the color side is outside, locating the metal part over your nose, putting the ring over your ears, making sure that the mask is reaching from your top of your nose down to the bottom of your chin, squeezing in that metal piece as well. Once that's done properly and correctly, again, as I stated originally, you're minimizing that risk. The mask is put on properly. And it's not just putting it on yourself, but if you're putting it on the loved one or your patient or your client that you're taking care of, that goes a long way. And then ensuring that when you're taking it off, you're taking it off correctly. You're not taking it off and putting it into your pocket. You're not taking it off and putting it onto a surface or a desk. Mind you, during COVID, we had to reuse them, and we did that by putting them into paper bags. But now that they're ubiquitous again, and there's a lot out there, by all means, you can throw them away. Putting it onto desk puts you again at risk, or putting it onto a surface and holding it on for another day or putting it in your pocket will put you at risk, because we have to understand that those masks, if that person that we've been handling all day, that loved one, that patient, that client, is sick, whatever aerosolization that they were spewing while they were talking to you, if they weren't wearing a mask themselves, is now on your mask. And by you taking your hand, putting it in there, putting your pocket, having your pocket dirty, having the surface dirty, you're just putting yourself at risk as well. And then once that's done and it's been thrown in the garbage, as I said, always wash your hands, ensuring that your hands are washed correctly and properly at the end of that as well. And again, ensuring that it's not being warm on your chin, your nose isn't showing, it isn't, it's above your chin, or your nose is out again. I've seen that many a times. Again, I've been working in infection control for 25 years. Everyone does it, including myself. I've done it a few times. I used to work as a managing director for a couple hospitals downtown, and I used to see physicians do it. iPad people doing it sometimes. You just have to remember it becomes a habit when you start putting it on correctly and ensuring that it's over your nose correctly and under your chin. And if it's not reaching under your chin, then there's a more likelihood that it's not fitting you. It's better you use a different mask if that's the case. But ensuring that it's worked correctly is very important at all times. And again, hand hygiene, as I said, the single most effective way to stop the spread of infectious diseases, again, is washing your hands. And memorize that one again, as I stated, because I'm probably going to roll back to this again. But ensuring that you're using liquid soap and water should be used when hands are visibly soiled. And here's a difference. I'm going to get into this just now as well. And that big thing with this is ensuring that if your hands are visibly soiled, always wash with water and soap. The only time that you should be using alcohol-based hand rubs is when your hand is not visibly soiled and you are probably in a point of care, you're doing a point of care risk assessment where your hands are visibly soiled, you're not close to water and soap, then you use alcohol-based hand rub as a way of means of cleaning your hands. Hand hygiene should be performed for at least 15 seconds. And again, to prevent any dryness, use a scent-free moisturizer after performing hand hygiene. Today, 2025, a lot of these things come with a lot of moisturizers inside of them. So you having to get another moisturizer put on your hand isn't really required. But by all means, trying to keep your hands as moist as possible is great, because if it is cracked and chapped, greater surface area for those organisms to hide, you'll get yourself sick and you'll get the people around you sick as well. So remember that as well. And again, just a quick synopsis or a quick brief on how to wash your hands correctly. I was going to self-promote myself earlier on, but I realized the slide that I was going to show wasn't working. Myself and the Care of Mushta and the Learning Regional Center put together a hand wash or hand hygiene presentation. Really great presentation. I would love to share with everyone, which I will share at the end of today's session. But it shows you the proper way of washing or to wash your hands as well. I know everyone's done this before, wet your hands with warm water, applying soap, lathering, wiping your palms, rubbing in between your fingers, back of your hands, your fingertips, rubbing your thumbs clasped in opposite hands, and then rinsing underneath, again, warm running water, and then pat drying your hands with paper towels, turning the sink off with the paper towel, throwing it in the garbage, and not opening that door with your bare hand now. Even if you have to use another clean piece of paper towel or the same one that you dried your hand to open the door, because you do not want to reinfect or recontaminate your hand at all. So again, I just went through that briefly. I'm going to be sharing this with everybody at the end of today's session. So by all means, and I'm sure everyone knows how to do this because we do it all the time, but it's a great reminder. And I love reminding people. And a lot of people say, "Oh, why are you teaching me how to wash my hands over and over? This stuff is getting boring. I know how to." I'm like, trust me, going over it over and over. The reason why we do it is because I do IPAC assessments and audits, and I see it over and over and over. And it isn't just caregivers, and it's just nurses, it's physicians, it's myself, it's everyone. We forget. Again, as I said earlier on, as Michelle said, I'm an airline pilot. As an airline pilot, we go for recertification or recurrency every 6 months. We go back to training every 6 months. I could be flying for 20 years. I have to do it every 6 months because we forget things. And by going over and over and doing it over and over, it becomes muscle memory and you memorize how to do it. It's a great way of remembering how to do things. This is just the ABHR way, how to alcohol-based hand rub your hand. I'm not going to go into this verbatim, but it's along the lines the same thing as washing your hands, where you want to get enough of the ABHR in your hand, rub your palms behind your hands, your thumbs between your fingers, and allow your hand to dry once you've completed about 15 to 20-second process to do that too as well. Is there any questions at all for me out there? Does anyone have any questions for me?
There was one question in the chat. I don't know, Mushra, if you're able to read it. Unfortunately, I
Uh,
was booted out from
yes.
weak internet, so I can't see
Okay.
the older questions in the chat.
Okay.
Yeah, I can read it out. So somebody asked, Anna asked, did I understand you correctly? I, as a caregiver, am eligible to receive the RSV vaccine for free since my husband received the RSV vaccine as a high-risk individual.
You should be able to get it as well. If you are a high risk individual of 65 years of, don't quote me, I apologize. It's just so many numbers are always thrown, either 60 or 65 years of age or older. Even if you're a community support services worker where you are working within a long-term care home as a provider of care, you should be able to get that vaccine too as well. If there's any issues with that, by all means, you can call me offline and we can talk about it one-on-one, but getting approval for that should not pose an issue. But we can talk about that offline. I know typically if you're in one of those criterias, you should be able to get that RSV vaccine, kind of like with influenza and COVID-19 as well.
So, Dale, if you are at home and you're a family caregiver caring for somebody that's high risk versus
You,
a healthcare provider or professional that's a caregiver.
you should be able to fall within those
Okay.
parameters as well. If you're taking care of a ill or a sick one at home as well. Yep.
Yes, that would make a lot of sense.
It would, yeah.
Yeah.
Any other questions at all?
Those are all the
All right.
questions.
All right, perfect. So we're nearly done, guys. I'm gonna get you involved a little bit more because I've been talking a lot and I think everyone's getting tired of hearing me now. But yeah, also understand the modes of transmission at home. So, what does my loved one have? If it's something like influenza, and again, I said contact is being occurs when germs spread through direct contact. So my husband or my loved one has COVID. They've been coughing all day. We know that whatever that's been aerosolized is going to be on the surfaces around them. So on their night table, on their bed head. So what do we have to do in terms of protecting ourselves in cases like that? We have to ensure that if the person, sorry, if we shake this person's hands, if we share toys with them, we hug or kiss them or share forks, there stands a chance that I can get infected as well. How to prevent it? We clean and disinfect the area. We provide hand hygiene. We may even do physical distance or even make sure that we're immunized or wear PPEs. Same thing for droplets. If you using influenza again as a really good example, my loved one who I'm taking care of at home has influenza or has COVID. Dale, what are examples of that? They're going to be sneezing, they're going to be coughing, they're going to be talking loudly, and they're singing. They're going to infect the things around us. There's going to be droplets of aerosolization around us as well. And how do we prevent ourselves from getting sick? We ensure the area is clean and disinfected. We provide hand hygiene. We may even physically distance ourselves, immunization and PPEs. And the final one, which we consider as a mode of transmission, is airborne. You might not deal with this all the time. This is when you're dealing with things like measles or tuberculosis at home. If a loved one has tuberculosis or measles, again, them sneezing, coughing, talking loudly will spew aerosolization in the air. And the difference between airborne and droplet is that the virus is so small that it can linger in the air for hours. I dealt with many measles outbreaks in Toronto, and there are times where people walk into rooms 2 hours after the person was positive left and still get infected with measles. So it's highly infectious. So how do I prevent or protect myself in a situation like this? Is I get immunized, ensure I have my measles, mumps, rubella, my MMR vaccine, ensure I wear a PPE when I'm around that loved person, maybe N95 respirator. Negative pressure room, you're not going to deal with this because you're at home. But if they're in hospital, they're going to be put into a negative pressure room as backup. Now, personal protective equipment. You heard me talk about that earlier on, and not everyone's going to wear this. If you're at home taking care of a loved one at home, you may wear this if this person is immunocompromised. Again, you're protecting yourself from them and vice versa, them from you. So you may wear gown, a gloves, a mask, or even eye protection. When you should wear this and why you should wear this is the big question. So what I like to tell a lot of people when they're caregiving or taking care of loved ones is ask yourself a few of these questions. What is the contact going to be going in with this client or this loved one? What type of environment am I walking into? Is there a risk of splash or spray? Am I taking care of a cut or a wound? What's this person's emotional cognitive condition? Are they irate? Are they angry? Are they going to grab me? Are they going to get irritated with me? And what type of symptoms do they have? Are they vomiting? Are they sneezing? Are they coughing? Because if they have any one of these symptoms, then what's going to happen is I'm prone at getting sick. And if I get sick, I'm going to get everyone else in the house sick as well. So in a lot of cases, we do recommend PPEs be worn when handling sick loved ones. And the type of PPE to be worn is all specific on the type of care that you're providing. So will my hands be exposed to bodily fluids? Yes, I'm going to wear gloves. Will my face be exposed to splash or spray, sneeze, or cough? Yes, I'm going to wear a mask. Will my clothes be exposed to splash, spray, or items contaminated with blood secretions? Yes. So I'm going to wear a gown. And does this person have any symptoms or known infections that I know? So does my loved one have influenza, COVID? Then I would follow specific additional precautions. So then, you know what? I might wear a gown, I might wear a mask, and I wear gloves as well to protect myself. Understanding that the reason that you're wearing PPEs, I'll say it again, you're protecting yourself from getting ill, and you're protecting them from also requiring whatever you may have as well, from them getting it, being that they're high risk individuals themselves. I won't get into donning and doffing per se. This is more or less in the hospitals, and if you're in the hospital or in a long-term care home, you would know, have a better understanding of this. But there's a way of taking it on and taking it off. It used to be called donning and doffing, and they now call it taking off your PPEs and putting on your PPEs and taking off your PPEs. Again, I'm going to share this with everybody, so you have an opportunity to take a look at that later on as well. And again, motor transmission, I won't get into it again as we spoke about. I just kind of want to reinforce that you have to understand the contact that you're going to have with your loved ones to determine what you're going to put on if you're going to be wearing PPEs to ensure that they're safe and that you're safe as well. And again, you see, as I'm coughing, if I had influenza, my loved one who would be taking care of me, which would be my wife, would more than likely wear a mask and possibly even wear a glove, depending on what she's doing in and around me, and ensuring that my area or my room would be clean and disinfected regularly because she would be in and out the room as well. So understanding the mode of transition or mode of transmission goes a long way when taking care of our loved ones at home. And again, question period, as we have about another 10 minutes. Just want to make sure I'm not boring anyone anymore and everyone's listening to me. Hand hygiene is the single most effective way to prevent the spread of germs. Is that true or is that false? I don't know if you're able to put up the question. Oh, there we go. All right. I won't, I know as we're kind of pressed for time right now, I won't stay on it any longer, but yeah, you guys are all correct. Again, as I said, ensuring that your hands are washed constantly is going to make a massive difference. So if you're washing your hands constantly and you're cleaning and disinfecting the area that you're at work with your loved ones, you will make a big difference at keeping them safe during cold and flu season. Thanks again, guys. Another one, self-isolation when ill. So with this new guidance and guidelines that was sent out recently, if you are sick, so self-isolate until symptoms have been improving for 24 hours or 40 hours if gastrointestinal systems and no fever present. Asymptomatic individuals with a positive test result do not need to self-isolate unless symptoms develop. The symptoms develop, they should self-isolate immediately. When going out in the community, if ill and required, ensure you wear a mask. So if you're out in the community, you're with your loved ones, they're sick, you're sick now as well, but you are required to provide care. Ensure that you're going to wear a mask when going outside, going grocery shopping, or doing the things that are required of you. being that you know that you're ill. Because again, you're trying to keep those around you safe at all times as well. So that's just something in a nutshell that's good to know during this period of time. And finally, modes of transmission, portal of entry, and susceptible host. What is it that we have to do to break this chain of infection? And this one's nice and easy and very straightforward, as I always say. With this, it always comes down to hand hygiene, PPEs, and vaccination, ensuring that the person's vaccinated and immunized for whatever illness is out there in the community. And again, as I keep on saying, we're dealing with cold and flu season right now. So ensuring that everyone is immunized in the home for flu, immunized for RSV, immunized for COVID-19. Try to treat any underlying disease and caregiver, client, loved ones, or patient education. So ensuring that everybody around you knows that these are the things that need to be done to keep themselves safe as well. So anyone in the house or anyone within the area that's feeling ill should stay home and self-isolate or have to go out because they're taking care of the home or taking care of your loved one. Ensure again, as I said earlier on, are wearing a not a well-fitted, but a medical mask or a surgical mask when going out. And going into the realm of vaccine, ensuring that people are vaccinated. And the reason why we push vaccine, I know there's always been this negative, I guess, negative thought on vaccine over the last little while after COVID. Vaccines are made to be safe and they're made to protect us. They're not made to harm us. They help people develop some form of immunity to a virus or germ. And it's a way for the body's immune system to develop antibodies specific to that virus. So if you get infected with something, your body goes like, hey, I know what that is. I'm going to create antibodies for this as quickly as possible so I don't get sick. Or hey, you know what? I still may get sick, but my illness won't be as hard or as severe because I'm vaccinated and I have antibodies. Or you know what? I might not end up in the hospital or dead. So that's the whole purpose or premise for vaccine is to try to minimize illness, duration, and severity of the illness as well. And some vaccines are there to prevent you from you getting the virus as well. That's the whole premise behind vaccines. They are safe and they're vital to keeping your family and keeping yourself in the community healthy at all times as well. And again, I'm just going to briefly discuss this, just overview. I'm not going to get into it too much because I'm going to be sharing this with everybody. We have the Ontario COVID vaccine program, which aims at getting everyone vaccinated. And again, there's a statement that Health Canada or the National Advisory Committee sends out on immunization, sends out every year. We call them NACI statements. And they always recommend individuals receive a recently updated COVID-19 vaccine in the fall when increased activity of respiratory virus is observed, which is around now as well. And again, the priority groups are here, age 65 years of older, individuals 6 months or less, residents of homes, First Nations, Métis Inuits, members of racialized and other equity deserving communities are a part of that criteria. And there's a longer list. I'm just apologizing I have not included everything because I didn't want to put too much on here. But there is more of a list that would incorporate you as well. And then when getting into other priority vaccine groups for COVID, underlying medical conditions that places them at higher risk of severe COVID, including children with complex health needs, definitely are at risk or high risk and should be vaccinated too. As I mentioned earlier on, we have the Universal Influenza Immunization Program, which has been running for decades. When I worked in public health in Toronto Public Health, over a decade, close to a decade ago, this was always in play where the government funded this and it's free. By all means, get your influenza vaccine every year. And again, there are high risk groups, but everyone's able to get vaccinated for influenza every single year. And the reason why we advertise this every fall is again the strains that are in the vaccine change because the virus itself mutates as it goes, mutates. It keeps on mutating. It goes through something we call, not getting to the sciences of it, or to the weeds of it, but it's called genetic shifts and genetic drifts, and it changes itself. It's smart. So we have to follow it, and we provide vaccines based on that strain. So that's why every year we ask people get vaccinated with the new strain. And again, as I said, the vaccines are all available through respiratory viruses. Antivirals are also available for influenza, COVID, and RSV. Immunization clinics can be scheduled at your local health unit and local drugstores. Highly recommended by NACI. And again, as I stated earlier on, the best way to keep ourselves safe and those around us safe is ensuring that we're cleaning and disinfecting the areas that we're working, proper hand hygiene, ourselves and our loved ones are vaccinated, and we're providing proper infection prevention and control care to the ones that we love as well. And with that, in a nutshell, thank you so much, everybody. It's been great.